Welcome to my YouTube channel Surfer Nursery in Structure. Today we discuss about human respiratory system MCQs. The respiratory system center which control breathing is located in the pons and medulla oblongata, cerebellum, hypothalamus, spinal cord. Correct answer is A. Pons and medulla oblongata. What is the primary function of the respiratory system? Transportation of oxygen, protection against pathogens, gas exchange, digestion. Correct answer is C. Gas exchange. Primary function of respiratory system is a gas exchange. When there is shortage of oxygen in the body, which organ is most affected? Intestine, skin, kidney, brain. Correct answer is D. Brain. The exchange of gases in the lungs occurs in the trachea, bronchi. The exchange gases in the lungs occurs in the trachea, bronchi, bronchitis, alveoli. Correct answer is D. Alveoli. The gases exchange in alveoli is type of sample diffusion, osmosis, active transport, passive transport. Correct answer is A. Sample diffusion. Alveoli is the type of sample diffusion. The dome-shaped muscles that help with breathing is called diaphragm, trachea, bronchi, alveoli. Correct answer is A. Diaphragm. The dome-shaped muscle is diaphragm. The maximum volume of air is contained in the lungs by full force inhalation is called tidal volume, vital capacity, ventilation rate, total lung capacity. Correct answer is D. Total lung capacity. Where does the impulse for voluntary forced breathing start? Medulla, vagus nerve, spinal cord, cerebellum. Correct answer is D. Cerebellum. Surfactant is a substance that prevents the collapse of alveoli, traps foreign particles in the lungs, regulate the pH of blood, help transport oxygen. Correct answer is A. In earth form, the process of respiration is through skin, head, lungs, pores on its anterior end. Correct answer is A. Skin. The structure that branches off from the trachea and goes into each lung is called bronchus, larynx, pharynx, epiglottis. Correct answer is A. Bronchus. After forced expiration, semi-one breathes in same volume of air by forced inspiration. What is this quantity of air taken in called total lung capacity, tidal volume, vital capacity, inspiratory capacity? Correct answer is C. Vital capacity. The structure that separates in the chest cavity from the abdominal cavity and plays a major role in breathing is called the sternum, ribcage, diaphragm, pleura. Correct answer is C. Diaphragm. The condition in which the bronchial tubes become inflamed and produce excess mucus is known as bronchitis, pneumonia, asthma, emphysema. Correct answer is A. Bronchitis. A person suffers punctures in his chest cavity in an accident. What could be its effect without any damage to the lungs? Reduced breathing rate, rapid increase in breathing rate, no change in respiration, cessation of breathing. Correct answer is D. Cessation of breathing. The tubes that branch off from the trachea and lead to the lungs are called bronchialis, alveoli, pharynx, epiglottis. Correct answer is A. Bronchialis. The condition in which there is build-up of fluid in the lungs, making it difficult to breathe is known as pulmonary edema, pulmonary fibrosis, pulmonary embolism, pulmonary hypertension. Correct answer is A. Pulmonary edema. The trachea is also known as the windpipe, alveoli, bronchioles, diaphragm. Correct answer is A. Windpipe. The medical condition in which air leaks into the space between the lungs and chest wall, causing the lung end collapse, is known as pleuritis, pneumothorax, hemothorax, pleural effusion. Correct answer is B. Pneumothorax. The medical condition in which there is bleed in the pleural cavity, causing chest pain and difficulty breathing, is known as pleuritis, pneumothorax, hemothorax, pleural effusion. Correct answer is C. Hemothorax. The condition in which the air sacs in the lungs become inflamed and filled with pus is known as emphysema, pneumonia, bronchitis, asthma. Correct answer is B. Pneumonia. In addition to respiratory function, the lungs also play a role in excretion, temperature regulation, pH regulation, maintaining the balance of body. Correct answer is B. Temperature regulation. Why is export to carbon monoxide harmful to animals? To reduce carbon dioxide transport, it reduces oxygen transport, it increases carbon dioxide transport, it increases oxygen transport. Correct answer is B. It reduces oxygen transport. When blood carbon dioxide concentrations rise, what happens to the breathing rate? Remains unaffected, decrease, stop, increase. Correct answer is D. Increase. What happens during inspiration? Correct answer is D. The diaphragm gets dilated and ribs get raised. A normal man at rest inspires and expires about 500 millimeters of air. What is the amount known as complemental volume of air, tidal volume of air, reservoir volume of air, residual volume of air? Correct answer is B. Tidal volume of air. After a normal expiration, the volume of air that remains in the lungs is called residual volume, vital capacity, expired capacity, functional residual capacity. Correct answer is D. Functional residual capacity. What is the covering of the lungs is called pericardium, pleural membrane, peritoneum, known. Correct answer is B. Pleural membrane. What does circulated epithelium in mammals' trachea do? Sucking inspired air in, perceiving sense of smell, pushing inspired air out, pushing mucus out. Correct answer is D. Pushing mucus out. Approximately 70% of carbon dioxide absorbed by the blood will be transported to lungs. Bicarbonate ions in the form of dissolved gas molecules by binding of RBC known of a. Correct answer is A. Bicarbonate ions. What will happen if only the thoracic wall is punctured and not the lungs? The lungs get inflated, the man dies as the lungs get collapsed. The breathing rate decrease, the breathing rate increase. Correct answer is B. The man dies and lungs get collapsed. Which of the following function by filtering and keeping the mucus and dirt away from our lungs? Cilia, bronchioles, hearts and lungs. All of the correct answer is A. Cilia. Why do we not respire for some second after taking a long deep breath? More carbon dioxide in the blood, more oxygen in the blood, less carbon dioxide in the blood, less oxygen in the blood. Correct answer is C. What controls the rate of breathing? The amount of freely available oxygen, amount of carbon dioxide, muscular function of the body, stress. Correct answer is B. Amount of carbon dioxide. Which of the following is respiratory disease caused by smoking? Asthma, bronchitis, pneumonia, tuberculosis. Correct answer is B. Bronchitis. The condition in which there is blockage of one or more arteries in the lungs causing shortness of breath and chest pain is known as pulmonary edema, pulmonary fibrosis, pulmonary embolism, pulmonary hypertension. Correct answer is C. Pulmonary embolism. The condition in which lungs lose their elasticity, making it difficult to breathe is known as asthma, emphysema, bronchitis, pneumonia. Correct answer is B. Emphysema. The exchange of gases between the lungs and the blood is known as external respiration, internal respiration, pulmonary respiration, cellular respiration. Correct answer is A. External respiration. The exchange of gases between the blood and the body cells is known as external respiration, internal respiration, pulmonary respiration, cellular respiration. Correct answer is B. Internal respiration. The condition in which there is high blood pressure in the arteries of the lungs causing shortness of breath and chest pain is known as pulmonary edema, pulmonary fibrosis, pulmonary embolism, pulmonary hypertension. Correct answer is D. Pulmonary hypertension. The condition in which there is scarring of the lungs making it difficult to breathe is known as pulmonary edema, pulmonary fibrosis, pulmonary embolism, pulmonary hypertension. Correct answer is B. Pulmonary fibrosis. The process by which oxygen is taken up the body and carbon dioxide is eliminated is known as respiration, ventilation, diffusion, perfusion. Correct answer is A. Respiration. The process of breathing in is known as inhalation, exhalation, respiration, ventilation. Correct answer is A. Inhalation. The amount of air that can be forcibly exhaled after a normal exhalation is known as tidal volume, inspiratory reserve volume, expiratory reserve volume, vital capacity. Correct answer is C. Respiratory reserve volume. A condition in which there is a long-term inflammation of the airway causing coughing and difficulty breathing is known as bronchitis, asthma, emphysema, pneumonia. Correct answer is B. Asthma. What is oxidative breakdown of respiratory substrates with the help of oxygen is called permeation, anaerobic respiration, or Q. Aerobic respiration. Correct answer is D. Aerobic respiration. Due to flattening of tracheal vessels, alveoli are deprived of oxygen in which disease? Bronchitis, asthma, pneumonia, emphysema. Correct answer is D. Emphysema. How much amount of oxygen is delivered to the tissues under physiological condition by 100 ml of oxygenated blood? Options 5 ml, 25 ml, 50 ml, more than 50 ml. Correct answer is A. 5 ml.